Yeah, my stomach too.
I was just thinking I should have gone.
Hello, my name is Herb Hazen, and I'm Vice President of the Radnor Township Board of Health. Welcome to another in an occasional series of programs called Radnor Health Matters. And my guests today are Sue McFarland, who is the Radnor High School Certified School Nurse and is our Radnor Township School District's Health Coordinator. Next to Sue is Amy Wishner, who is Director of Immunization and Curriculum Development for the Pennsylvania chapter of the American Academy of Pediatrics. And next to Amy is Andrea Shapego, who is Director of Student Services and Special Education for the Radnor Township School District. Welcome to all of you. In June 2009, the World Health Organization declared a worldwide swine flu, or what we now call novel H1N1 pandemic, which basically means it's a worldwide epidemic. The H1N1 flu virus is contagious and can spread from human to human. The infection is similar in most cases to the seasonal flu and occurs when an infected person coughs or sneezes, and then another person may walk through the aerosol droplets that have been sprayed into the air, or you can also pick it up from touching something that an infected person has touched after sneezing or coughing. In addition to the declaration by the World Health Organization just this past weekend, President Obama declared the swine flu to be an emergency. And this is on top of the fact that the CDC, Centers for Disease Control and Prevention, maps of the spread of novel H1N1 indicate that basically in Pennsylvania, as in many other states, it's widespread. The infection is widespread. But what does the fact, Amy, that the President has declared this to be an emergency, what does it mean generally, and what does it mean for us here in Radnor?
Well, I think as President Obama has said, it doesn't mean anything's different about the disease. So he's not saying the disease is suddenly more serious, but what it does offer, and essentially it's really a bureaucratic assistance to schools and hospitals in particular. It offers hospitals a lot more flexibility in dealing with a big increase in sick patients. So, for example, if a hospital needs to figure out a way to have to be able to handle more people in their emergency room, that because hospitals are being overwhelmed with the number of people coming to the emergency room and also requiring various kinds of respiratory assistance, it offers them an easier way to proceed bureaucratically to get certain kinds of waivers and assistance to be able to change the way they do things. But you brought up a great point about how the disease is spread, because when you think about that, it relates to why we're really concerned about young children, because they're not as careful with their nasal secretions. And, you know, we can all think of young children we know who are not careful with their nasal secretions. You can't expect them to be. So, you know, that really has a lot to do with who's recommended to be immunized and precautions that we want to take to keep ourselves healthy.
Yes, thanks. And as Sue reminded me earlier this morning, when we were going to shake hands, that we shouldn't be doing too much of any of that anymore.
They call it social distancing.
Yes. So what is the situation in our Radnor Township schools with regard to either the novel H1N1 infections or what is called seasonal flu? Schools in general or Radnor High School in particular?
Well, last spring, I believe it was in May, when there was initially the H1N1 became aware of the public. There was a lot of press and information out about that, and so I think that we had a head start on information. And so I think for the beginning of the school year, our administration and was well prepared to get information out. We had posters, we had announcements, and to make kids aware of how important washing your hands are effectively, washing them for 20 seconds or singing happy birthday twice. If they needed to coughing into a bent elbow, preferably with a tissue that you could dispose of, but if that wasn't available, coughing into the bent elbow. So with making the school community more aware, that was very helpful. In terms of absences, our absence rate was better than usual since the beginning of the school year until last week with the Phillies. So it was hard to determine that we had kids staying up late at night watching our Phillies and came to school late. So we did have an example one day last week. We had 138 students out of over 1,200. And as it turned out, those students came in late, and it was due to the lateness due to the Phillies. So our absences have not gone, they've been on target. We've never gone over. But I do see a number of sick kids, that do go home, and the parents seem well informed in terms of to keep the students home when they need to be.
I was going to ask you about that, Sue, because isn't part of it having to change the culture about come to school no matter what, to if you don't feel well, stay home and stay home till at least 24 hours after you're fever-free without
exactly that has
fever medication.
Exactly. In high school, kids are worried about their futures and getting their assignments done and being ready for the college of their dreams, and so there is that pressure to be. So it is working with the culture, and when you call a parent to send a student home, it's directing them to keep them home for 24 hours fever-free without the assistance of analgesics to keep it down. So it is a little difficult to get that message across, and I'll even get a call back from a parent, "Are you sure?" Yes, but they are following.
Speaking of our parents, we really have had a great deal of cooperation with the parents in terms of keeping their children home. And I think I brought with me a couple of the signs that we use and post in all the schools. And one says, "We're in this together." And I have to say that the community has been really wonderful in terms of working with the school district, the policies and the procedures and the plans. So things are pretty well organized. It's not something that we deal with every day. It's something that beginning in the spring, the administration and the school district in cooperation with the parents and our entire community, work together to really develop a plan, just in case something should happen.
Well, Andrea, since you mentioned policies, I wanted to ask: Does the Radnor Township School District, especially in light of a recent closing of a major high school in the area, does our school district have a policy regarding school closures in the event of outbreaks of infectious diseases?
We do have a policy that covers communicable diseases and immunizations, and it's a general policy. It doesn't really impact on the H1N1 outbreak at this point. It doesn't really deal only with seasonal flu. But the district has been guided pretty much on a daily basis by the CDC, by the Pennsylvania Department of Health. We work in collaboration with them. We have contacts, phone contact with them very frequently. And so what the district did is to put together a plan, an H1N1 plan, which can be really used for almost any communicable disease outbreak in the district or in the community. And we follow that plan. In fact, we just reviewed it at our administrative council meeting to be sure that that plan has been going on. We evaluated it. We made sure that everything was in place. So, yes, so in terms of a policy, if you went to the board policies, you would see a policy on communicable diseases, but not necessarily specific to H1N1.
And the general public can access that how?
On our website, they would go to parent information, I believe, or school district information, and there's a site for board policies.
And the website is www.rtsd.org?
That's correct.
Is that correct?
Mm-hmm. That's
Okay,
correct.
good. Thank you.
There's also on that website daily updates on H1N1 and other information that would be related to how to deal with the communicable diseases, and especially H1N1 at this point. So that I want to just remind everybody that there's a wealth of information on the school district website.
Thank you. Amy, we've been talking about H1N1 and, or I should say novel H1N1, since we've been dealing with H1N1 generally for a while. But I gather that the vaccine for novel H1N1 is still somewhere in the pipeline. It isn't readily available here in this area, if it's available at all. While we're waiting for that, can you tell us something about whether people should still feel motivated to get the seasonal flu vaccination, and what would be the relationship there with providing any protection against novel H1N1?
What we call the seasonal flu vaccine does contain 3 strains of influenza, and one of those strains is an H1N1, but not the same H1N1. It's called I think it's 2007 H1N1, and we're dealing now with 2009 H1N1, and it does not look so far as if the two have any cross protection. So in other words, the seasonal flu vaccine with the 3 strains that are in that would not provide protection against the 2009 H1N1. The first positive lab test for one of the strains that is in the seasonal flu vaccine was last week in Pennsylvania. So people do expect that the viruses in the seasonal flu vaccine will be making their appearance probably a little bit later in the season, but people should, as the vaccines are available, should get both their seasonal flu vaccine and their H1N1 vaccine. Both those vaccines are licensed and recommended for people 6 months of age and older. So, and for the children younger than 6 months of age, we want as much as possible to cocoon them, to have them surrounded by immunized brothers, sisters, aunts, uncles, parents. So people should still get their flu vaccines. And you're right, there have been shortages of both the seasonal flu vaccine and a delay in the expected, and a shortage in the H1N1 vaccine.
Well, who should, and again, there are differences with regard to both kinds of flu vaccine as to the targeted populations. Can you tell us a little about who should receive?
Well, one difference, for both types of flu vaccine, and this really relates to the schools, the people who are the main spreaders are the children, both because they're not as good with the control of their nasal secretions and don't always cough into their elbows as much as we would like, and also because they're in close proximity in the schools. So it's just a little perfect incubation place for the spread of a variety of infectious diseases. But the one difference that we do see between seasonal flu and the H1N1 is that it seems that people over age 64 do have some remnants of protection against the 2009 H1N1 vaccine. When you look at antibodies to similar H1N1s, they increase. In other words, you are somewhat better protected the older you are. For young children, there is 0% of these antibodies, whereas you get older, you find about 36-37% protection. So the seasonal flu vaccine is really targeted a lot towards very young and very old, because that's who has the greatest rates of disease and hospitalization and death. Whereas with the 2009 H1N1, we're not seeing those high rates in the senior population. We are seeing them in the younger population. So particularly in terms of early groups, we really want to focus on protecting people around those children younger than 6 months of age. I'm sure people have also seen reports in the popular press about pregnant women having particularly higher rates of hospitalization from 2009 H1N1. So pregnant women are also a particularly targeted group, although they also are recommended to get seasonal flu vaccine. And then healthcare workers, daycare workers, people with any underlying health problem, asthma, any kind of respiratory condition, heart condition are also recommended to get H1N1 vaccine as well as seasonal flu vaccine. And healthcare workers in particular, there's a big push to, and there has been for the past several years, to really encourage healthcare workers to get flu vaccines and protect themselves, their patients, and their communities.
What are the symptoms of 2009 or novel H1N1, and how do they compare with the symptoms of regular or seasonal flu influenza?
They're pretty similar, and Sue, you can join in on this. I mean, the one thing, the usual kind of respiratory cold symptoms, but when people have sort of minor sniffles, they most likely don't have influenza. They really will be higher, tend to have higher fever and be quite laid up with influenza as opposed to other kinds of respiratory infections, which also circulate at this time of year. With H1, the 2009 H1N1 doesn't always give a fever and tends to have more kinds of diarrhea and intestinal problems. But other than that, is quite similar to seasonal influenza. Sue, do you want to add to that?
And a number of students that I've been seeing have had a fever of 100 or above. They have had sore throat, cough, and just tired in general. The symptoms appear very much the same. And I think, if I'm not, we kind of feel that regular seasonal flu has not been present. So when we see students presenting with these symptoms, we feel that very much it probably is the H1N1. And so students that have a temperature of 100 or above are sent home and asked to stay home until they're fever-free for 24 hours without the aid of analgesics. So, and a lot of the symptoms I've been seeing has been the cough, sore throat, fever of 100 or above, and tiredness.
What's your sense, Sue, of whether or not kids are actually seeing a physician after being sent home to try to confirm a diagnosis?
Well, I think early on with this, parents were bringing the students to the doctor. The trend now, because they know the novel H1N1 is here in the community, that doctors, the parents, I encourage them to contact their family doctor and let their doctor know, do you need to see my child or not? And some doctors will advise them how they should proceed and when they need to contact the doctor. So that's what we're seeing. It's interesting. I'm also seeing students that have come back with a probable diagnosis from their family doctor that they have H1N1, is that there seems to be a relapse. Students are coming back to school fever-free for 24 hours after they start to feel better, and they're back in school for a day or two, and then they start to not feel so well again. And contacting the parent and having them go home. And also I recommend that you please contact the family doctor to let them know, that here they had probably had the H1N1, seemed to feel better, but seemed to be having a relapse. So they're very important to contact their doctor about that.
Doctors are not routinely doing testing. The in-office testing that's available is not that good. It's not that sensitive, it's not that specific, and what that means is that you don't always know that when you get a positive test that this is in fact what you have as opposed to some other similar thing. And it also means when you get a negative test, that doesn't always mean that you don't in fact have this disease. So people are not being routinely tested unless they're hospitalized. Physicians have been told not to continue to do testing because it wasn't really that helpful, and they're supposed to be going on their clinical diagnosis. The Tamiflu and other similar medications are not routinely recommended for everybody. Because for a couple of reasons. One is, every medication has possible side effects. You don't want it unless you really need it, and we don't want to be developing resistant organisms. So they're not going overboard with the antivirals. On the other hand, people for whom antivirals are strongly considered include children under age 2 and people who have a relapse. That's what they've seen so far in the epidemiology of the disease and of the serious disease is that people who have relapse tend to be sicker. So routine testing is not being done unless you're hospitalized because it's not that helpful. And pediatricians and family medicine physicians are being so overwhelmed with the number of sick children, adolescents, and adults that they don't really want to see everybody. So everybody is not being encouraged to actually go to their physician. But certainly high fever, difficulty breathing, relapse, under age 2, having a chronic underlying health condition, those are the people that physicians want to be seeing right away. And
pregnant women?
Yes, and pregnant women.
Andrea, and this is probably a question that all of you can address, and I hope you will. But Andrea, the Radnor Township School District recently, in cooperation with the Board of Health and others, recently conducted an in-school seasonal flu vaccination program utilizing the nasal spray mist. Can you tell us something about what were the results of the program, and does the Radnor Township School District have any plans for repeating that or using that same sort of format for administering vaccine for novel H1N1 when that's available?
Well, let me just start by saying that we were really happy with the way the flu mist program went. And a few years ago, actually, the first time I met Amy was when we began the program. Amy was very encouraging and helpful in terms of the importance of school clinics and the importance of schools being part of the community in terms of being able to immunize children. So we started the program in middle and high school over the past few years, and it's been relatively successful and probably gaining more and more success as we go on. This year, we had about 40 students in each of our schools, each of our 5 schools, because we increased the administration we expanded the administration to our elementary schools this year. So now the entire district, 5 schools, the middle school, the high school, and the 3 elementary schools, were a site for distribution of the flu mist or the nasal mist. I believe that we will continue to do that, and I think that it has really worked very well. It's given us a little bit of a head start in terms of our administration of the H1N1 vaccine, should that come about. But for the most part, the district has practiced in our point of distribution drill recently held to prepare the district and the community for this kind of immunization. So the district's ready. We're ready to go in terms of administering vaccine at our high school, which is the point of distribution. We volunteered to do so. As we speak, our superintendent is meeting with the other superintendents and officials of the county to try to get a coordinated effort in place so that every school in Delaware County will be a part of the distribution of the vaccine. They're asking the hospitals for volunteers to administer, and the county is taking sort of charge of it. The problem right now is that we don't have details yet, but as soon as we get them, we'll be ready in the township, in the district.
And Sue, maybe you're the point of distribution or pod coordinator here for our township. And so maybe you know the answer to this. My understanding is what you've described is basically comes into play in the event of an emergency situation where the high school might be used as the point of distribution or pod. But what about, and correct me, Sue, if that understanding is flawed, what about for routine? In other words, once, as we've been talking this morning, the novel H1N1 vaccine is not readily available, but at some point it will be. And an in-school program at all levels might be a good way to rapidly immunize a lot of young people. And as Amy has pointed out, they are the ones who spread this disease most readily. So what are there any plans afoot with regard to utilizing schools as a site for routine? And either one of you can answer that. Routine.
Yes, I think the pod exercise that we engaged in June, that acts as a model for us, so that if this becomes available, we now have a plan in place so that as it is distributed, how you move, volumes of individuals, individuals that need assistance, and many of the things that you deal with in a pod situation, we now have that model to execute this plan, more effectively to distribute to many in a short amount of time.
Herb,
I'm just thinking also that just to point out that at this point we are getting direction from our from the Pennsylvania Department of Health and the county, so that when we get the word, we'll be ready to put things into action. We have planned in terms of how we will do that in the district, but at this point we haven't heard anything in terms of when we're going to get the vaccine, or if we will even be called as a pod. That will be determined by the Pennsylvania Department of Health and the county.
Amy?
I just wanted to add that the situation that we're in, we're trying to essentially do mass vaccination, is really a new one. And different states are doing it differently, different counties within our state are doing it differently. But the idea of trying to do it primarily at pediatric and family medicine offices is really difficult, because you have the exact same staff there. They don't have additional staff. They don't have the ability to call in additional nurses. So you're asking the same staff to do 10 times the amount of work. They don't have additional vaccine storage space. It's really been extremely challenging, and pediatric and family medicine practices are just absolutely pushed to the brink, and dealing with a lot of irate parents, dealing with a lot of parents with a lot of questions that are very time consuming to answer. And it's just been very difficult. Schools as a site of mass vaccination is something that we haven't done really since polio. And those of us who are a little older remember lining up to get our sugar cube with polio vaccine on it. But flu, we're trying to do this in a very short amount of time. We're trying to, in a certain sense, we've been fortunate in this area. We're a little bit still ahead of the disease curve. There still is time where vaccine really could make a difference here. Can we get the vaccine into, people as quickly as possible? That's, we still don't know. And whether some schools in other parts of the state, many are providing clinics, not every single school. So we'll have to see what role we can do here. But it's just a very challenging situation. You're trying to do this mass vaccination of all these targeted groups who have, for the most part, have no antibodies, no resistance to this new, as we call it, novel 2009 H1N1 vaccine. So we all are trying to work together to provide flu vaccine in as many sites as possible. But of course, we need the vaccine. So that's
Yeah, I also want to mention that the school district has been in touch and is constantly in touch with the parochial and private schools in the township as well. We had a meeting. Our superintendent, Amy, attended the meeting, and it was very well attended with representatives from all the parochial and private schools in the area, so that we're keeping in touch with them, keeping them up to date, and they'll be certainly included in any of the plans that we make.
And many of them have been providing flu mist for their students as well for several years. Mm-hmm. So,
well, thank you. That concludes our program for this segment. There are, for those of you who, and I encourage you to do this, need to get more information or simply want to get more information, a number of websites from which you can do a lot of exploration into some of the issues we've discussed here today and get a lot of information as to what you and your family should be doing with regard to these outbreaks of infectious diseases, including the flu. So again, thank you, and that's it.